think anything anyone tells you about this is based on nothing. It's based on models of viruses that we've already known that have been in humans for hundreds of thousands of years. So there's not a model for this. It's causing diseases that are unexpected. It's hitting every population. The virus has its own, it doesn't have ideas, but it doesn't care about us either. It's completely agnostic. And so as long as it has hosts that it can be in, it will continue to do this. Early on in this, people kept saying, well, you know, I don't know if we want to talk about that because people might panic. I'm going, so, I mean, you know, they have to get over it, and they have to understand it. I'm Mark Denison. I'm a medical doctor, pediatric infectious disease specialist. I'm at Vanderbilt University Medical Center, where I have been since 1991, and I have been studying coronaviruses since I started my training in 1984. So for over 35 years, I've been studying the biology of coronaviruses. Our focus has been on antivirals, so developing drugs that would directly be able to use to prevent it if you're at high risk, or to treat you if you get sick, or to prevent you from getting really sick if you already have an infection. Since this COVID-19 came out, we've had two major drugs that we have published and are now being tested in people. That looks like magic, like we sort of out of somewhere picked them out of a cabinet, but we've been working on those for over 7 years. In all of our grants and all of our papers and all of my talks, I say we need to be prepared. We need to have antivirals for coronaviruses because there are so many in bats out there that could get into humans, and we need to be prepared to treat those. Viruses evolve in humans, and most of the ones that have been in humans have been around for thousands of years or hundreds of years. And their seasonality has something to do with meteorology, but it has a lot to do with the availability of vulnerable populations. So seasonality is an observation that people never have understood for any virus, and now they're predicting that because this is a virus, it will become seasonal. That is not logical thinking, and it has nothing to do with understanding of the virology. That is hopeful thinking. There's nothing different. The virus hasn't changed, okay? It didn't suddenly become milder. It's not suddenly saying, you know, I've had a nice spring, I think I'll go to sleep for the summer. Now, some viruses, like other coronaviruses, are kind of seasonal, but we can get them over and over and over again every third year or so because our immunity doesn't last really a long time. And that's another misconception, that the virus is rapidly mutated. Well, for things to change, they have to have what's called evolutionary pressure, right? So if the virus is happy in the human playground and everybody around it is susceptible, what virus is going to be better than that? If it has mutations, unless that virus is better than the one that's out there, it's not going to emerge in the population. So there's no evidence that this virus is undergoing significant evolutionary change, that changing the disease right now. So it looks like one strain pretty much. Coronaviruses can change, so that's but probably at that point then you have some protection even if the virus changes. It's not like it's starting all over from scratch. You still have enough broad immunity in the community to kind of protect everybody and turn it into a virus that may be more like a cold virus rather than this devastating one. If you're honest as a scientist, my goal isn't to protect as much to protect individuals as it is to create a herd immunity that's high enough that the virus can't find enough susceptible people at a high enough level to make enough new virus to shed it to new people. The virus is telling us that it's still around, that there's still a large susceptible population. Now, that means if we're going to get around to opening up the country, we need to have staged, very careful guidelines, and we need to be willing to go back if, in fact, the evidence shows us that things are getting worse. I think from a truly virological and biological perspective, we're probably about 2 to 3 months premature to opening up the country. You know, it's hard to think beyond this right now, but we're already doing that. We're already really preparing right now. As we test new drugs, we're also preparing for the next pandemic. I'd say just keep listening to the science and people like Tony Fauci and the CDC and the NIH. I want my real PSA, if there's college students, university students who are interested and see that the importance of emerging diseases and the changes that occur in our climate, in our environment, in our actions with nature, and our interactions with wildlife, that there is a huge amount to learn, and we need new ideas, and we need new people who aren't biased, who don't have an agenda, who are just really interested in understanding the biology, who really want to learn it. I think the data says 3 of these in 20 years that there will be another one. The question is can we learn from this? And can we prepare scientifically and culturally and socially, both from a public health perspective, and can we have the science ready so that these drugs that we're working on now, we'll keep working on them, and we'll work against every coronavirus we can find, and so that when something like this happens again, we have those that we can deploy immediately.